Hello everyone and welcome to Study. Today we are going to learn about an important technique which is the von Herrick technique, right? So von Herrick technique is the qualitative method, right? So it is the qualitative method. So qualitative method. What is the von Herrick technique? It is a qualitative method and it uses an important instrument, that is the slit lamp. So von Herrick technique uses a slit lamp and it is a qualitative method for the analysis of what? Of the analysis of peripheral anterior chamber depth, right? So it in short it tells us about the angle, anterior chamber angle, that is either the angle is open or closed. So what is an angle? Anterior chamber angle. So we all know that this is our eye, right? So this is our eye and over here we have the crystalline lens. Here is the ciliary body and here is the iris, right? So here is the iris, this is the ciliary body, these are the zonules that are holding the lens, and here this is a cornea, right? So this is the anterior segment, this area, the area between the cornea and the lens is the anterior segment of the eye, right? But the anterior segment is further divided into two chambers, right? So one is this one, the area between the cornea. So this is the cornea and this is the iris. So the area between the cornea and the iris is the anterior chamber, while the area between the iris and the crystalline lens is the posterior chamber, right? So the junction between the cornea, this is the cornea and this is the iris. So the junction means that the point where the cornea and iris meet. So this is the point, right? Over here, this specific point is the junction between the cornea and iris. So this is a cornea and this is the iris. So the angle or the junction, the point where both these structures meet is the point which we know as the anterior chamber angle, right? Anterior chamber angle. So the irido junction or iridocorneal junction. So irido means iris, corneal junction is basically the anterior chamber angle. So anterior chamber angle, what is the importance of this angle is posterior chamber, they go to anterior chamber in order to provide nourishment to the cornea and in order to maintain the structure of the eye, and then the aqueous humor which was produced in the ciliary body that moved from posterior chamber and came to the anterior chamber in order to provide nourishment to the cornea, it has to drain out by this angle, right? So this point is very important for the drainage of the aqueous humor. So anterior chamber angle's importance is that the drainage of aqueous humor is done by the anterior chamber angle. So if the angle is closed, it means that if this opening is closed, what will happen? That the angle is narrow. Here the angle is wide, it is open, so the aqueous humor can be drained easily, right? But if the angle is closed, it means that this is a cornea and this is the iris. Due to any reason, the iris and corneal junction has been attached to each other or there can be any problem, right? So what happens? This angle becomes narrow. So if this angle becomes narrow, it causes the problem to the patient. How? The aqueous humor which was produced in the ciliary body now gets into the anterior chamber and the anterior chamber is filled with aqueous humor, but there is no drainage. aqueous is getting filled in the eye, but it is not getting out of the eye. So what will happen, that due to the increased production of the aqueous humor but the decreased drainage of the aqueous, what will happen, that the eye pressure will be increased. So the eye normally should be like this, but what happen when the aqueous is filled, so the pressure of the eye is now raised. So the cornea iridocorneal junction is closed due to any reason. So what will happen, that this was eye, the crystalline lens. So the area is filled, the pressure is increasing, but there is no drainage. So what will happen, that production is continuously happening, but there is no drainage, and the eye pressure will be increased. And when the pressure of the eye increases, what happens, that optic neuropathy occurs, optic nerve gets damaged. So when the pressure of the eye is so increased, it will cause the glaucoma. So von Herrick technique, basically qualitative method of analysis of the peripheral anterior chamber depth, so that we know that either the patient may be suspected to glaucoma or not. If the pressure of the eye is increased, we can't do gonioscopy in every patient, right? So what we do is, we do a simple method, that is the von Herrick technique, by which we analyze that either the patient's anterior chamber is closed or not, or anterior chamber is blocked or not. So if we come to know that any patient has a closed or blocked anterior chamber in von Herrick technique, in that case what we do, we refer the patient, or we further get into the gonioscopy technique, right? So gonioscopy is not done on every patient, that is why a simple technique is performed, which is the von Herrick technique. So I hope you got the point, that why do we use the von Herrick technique. We use it for the analysis of the, or for the assessment of anterior chamber depth, and we analyze the angle, anterior chamber angle over here, and we use a slit lamp for this purpose, right? So now let's see and see how we perform it. Okay, so now the brief introduction is already done. Now we are going to see that how to perform the von Herrick technique. As I have already discussed that we use a slit lamp for this technique. So you have to ask the patient to sit on the slit lamp with chin and head and chin rest, right? So the patient is on the slit lamp, and this is the headrest and this is the chin rest, right? So now I'm just going to draw the eyes of the patient, so that you know what I want you to know about this technique, right? So this is the patient's eye. So now what you want in this technique, you have to ask the patient to see straight. While the patient is viewing, or patient is fixating straight, you have to make your illumination, right? Illumination system. The slit lamp has two parts. One is the lighting system. Okay, so slit lamp has two structures. One is the lighting system or illuminating system, or illuminating system is a system from where the light is directed onto the patient's eye, right? So you have to pick that illumination system. This is the illumination system. You have to bring this illuminating system to the 60-degree, right? So now the light is directing onto the patient's eye like this, right? In this direction. So here, so the angle at which the illumination system should be, that is 60-degree. At 60-degree you have to place the illumination system and throw the light at patient's right eye. So the light is now at patient's right eye at the angle of 60-degree, right? So now what you are going to do, so the beam is placed at 60-degree, and at which structure the light should hit, it should be limbal area. So at limbus you have to throw the light on the patient's eye. Got it? So I'm repeating, your illumination system should be at 60 degree and you have to throw the light at the limbus of the patient. So if you see the limbus at here, there is a junction inside our eye, that is corneo-iridocorneal junction, which is also known as the anterior chamber angle, right? So here is the anterior chamber angle, here, here, but we are going to find the anterior chamber angle, peripheral anterior chamber angle. So here and here we are going to find, right? So we are going to see temporal and nasal limbus, and from there we are going to assess the anterior chamber angle. Okay, so these are the eyes of the patient. This is the pupil of the patient. So now, as I have already told you that the illumination system, or simply you should know that the light should be thrown at the angle of 60 degree, right? So the angle forming between illumination system should be 60 degree, or simply you have to adjust the illumination system at 60 degree such that the light is throwing or light is getting onto the limbus of the patient, right? So this is the limbus, you have thrown the light at the limbus, but make sure that the beam of light is very narrow, right? So in that picture I have shown you a little bit wide, but the beam should be narrow. So light beam should be narrow, and okay, this is the eye, you have thrown the light at the temporal limbus of the patient. This is the pupil of patient, right? So now what will happen? There will be two beam of light. One beam which you are throwing at the limbus, while there will be a reflection. One will be the reflection on the iris. So you will see two lights. One will be the light which you throw onto the patient eye, right? And there will be two bands made. So what I mean to say is that when you will direct the light onto the temporal limbus, what will happen, that you will see the reflection on the iris. One is the reflection on the iris, while other one is the corneal section. So this one will be in white and you will see a corneal section. So this is very similar to the technique where you see the layers of the cornea. So but at that point you are placing the corneal light on the pupil and you get two lights and you are going to see the cross section of the cornea. So the method where you are going to find the cross sectional of the cornea is similar to the method you are going to do for the von Herrick technique. So basically when you throw the light onto the patient's temporal limbus, there will be a band, a curved band, which will be telling you the cross section of the cornea, right? And there will be reflection on the iris, light reflection. So there will be a thin, or there will be a gap between corneal band and the iris band, right? So you have to compare the band, this corneal section band, with the gap, this gap, right? So you are going to measure this gap with this corneal section band, right? And this will tell you about the peripheral anterior chamber depth, or you can say that it will tell you about the angle, that either the angle is open or either the angle is closed, right? So the corneal thickness, this corneal thickness is compared with this band, this black band. So what will be here? I am repeating, this will be of white color, white black color. It will be of yellow color because it is a reflection of light, but this area will be black in color. So you are going to compare this black area with the white area, which was the cross section of the cornea, right? So let's see how it will appear. Okay, so here I have drawn three images and you can see the difference between each image, right? So just you can observe the difference between three images. So the black one, this black one is the corneal band, right? So here I'll show this black one is this structure is the corneal section, in order to make you more clear, right? And this striated structure which I have drawn is the reflection of reflection of light on iris, right? Reflection of light on iris, right? And the gap between is visible. Here you can see the gap between both structures. So now over here I have drawn the corneal section in black, but on the slit lamp it appears as black white structure, while the reflection of light on iris appears as yellow. But here I have drawn these two in black and striated manner so that you can understand, right? So our purpose is to understand this technique only over here. So if the distance between, or the gap between the cornea band and the iris reflection is equal or is greater, right? If the gap, this was the gap, this is a corneal band, this is the reflection, so this is a gap which we have to compare with the corneal, this black section, right? So we have to compare the gap between these two reflections or light. This is a corneal band, this is the corneal band, and this one is the iris reflection, right? So the distance between, so the gap which is between the corneal band and the iris band is the gap which we have to compare with the corneal band, right? So if the gap is equal, again, is equal or greater than the corneal band, it means that our angle is open, right? It means that it is indicating the angle, open angle, right? So it means that it is a normal state. If the gap is more or equal to the corneal band, here you can see it is more, the gap is more than the corneal band or the thickness of the corneal band, so what it shows that it is the open angle. So this is a normal state. So in this picture you can see that the gap between, or the angle formed between corneal band and reflection on iris is more. So this is the example of the open angle, and we can say grade 4 open angle. In the second picture you can see that the difference is approximately equal or less than, a little bit less than the corneal band. So I'll take it as an equal. So if the gap is equal to the corneal band, so this black one is a corneal band, right? And this is the gap which we have to note, and this is a reflection on iris, right? So this thickness is almost equal to the contact lens. So it means that the angle is open, right? So still angle is open. You can see that the gap thickness and the corneal band thickness is almost equal, right? So angle is still open, it is also a normal state. But if the case is here, this is the corneal band, okay, and this is a little bit more, this is such that this is the striations, right? So here in this picture, you can see the gap is almost half of corneal band, right? So the thickness of the gap is almost half of the corneal band. It means that patient is, the angle is still open, but it is suspected, right? At this stage patient should be observed, right? Or the IOP should be checked, and the patient should be observed continuously, because there are chances that the angle may be closed, right? So we say that this is almost the grade 2 or grade 3 type, where the angle is near to block, right? So this is almost half of the you can see that this is at approximately half of the corneal band. This gap is almost half of the corneal band, so this is suspected, right? So here we need to check the further that in these cases you really need to focus that there may be a problem, right? So, and in the fourth picture here you can see that there is no gap between the cornea and the iris reflection, right? Corneal band and iris reflection, this is the totally closed angle, right? So here there will be the angle, narrow angle, or the angle may be blocked when there is no gap between this. So this was suspected. At this case, here you should do gonioscopy in order to check that either there is near to block or not. And at this case, if you find these two cases, it means they are, the patient is suspected to glaucoma, or it's not always glaucoma, there can be ocular hypertension as well due to the narrow angle, right? So the angle examination is very important. There may be glaucoma, there may not be glaucoma, but due to the angle blockage there can be chances that it can turn into the glaucoma, right? So here when you see half of the corneal band thickness, the gap is half of the corneal band thickness, you should do gonioscopy, you should do fundoscopy in order to check the optic disc. And at this point there is a dangerously narrow angle, so that should be, in this case the every measure should be done to check the angle. The fundoscopy should be done, optic disc ratio should be checked, so that we may stop patient to get glaucoma, right? Equal or greater, right? So these two are the example of grade 4 of the classification or the chamber depth in corneal thickness. So these are we have divided them into the grading. If you see the thickness of the gap is equal or greater, it means that it is grade 4, the angle is open. But if you see half, or 1/4 of the thickness, it means that there is now a grade 3 and grade 2, right? If the thickness is half, it is grade 3. If the thickness is 1/4, it is grade 2. And if you have seen the thickness which is less than, there is very minimum thickness, right? If there is very minimum thickness, this type of, right, and there is some little gap but it is less than 1/4, it means that this is a grade 1. And when you see such case, it means it is grade 0 and the angle is dangerously narrow and you need to do gonioscopy, you have to check the fundoscopy, you have to do the cup disc ratio, you have to check every aspect, right? Okay, one more thing is that when you see grade 2, 3 or 0, you should not dilate the patient, right? Because what will happen, that patient's angle is already narrow. So if you will dilate the patient, what will happen when you dilate the patient, the pupil get dilated, right? So when the pupil get dilated, the angle becomes narrow, right? The iridocorneal junction becomes narrow when you dilate the patient. So never ever advise dilation when you see these cases, right? You have not to, you don't have to dilate that patient. And for the gonioscopy and for fundoscopy, you just need to do the gonioscopy without the dilation of the pupil, because if you will dilate the patient, the angle is already blocked. It will, when you will dilate, pupil will dilate, sphincter muscles will contract, the distance or the gap between cornea and iris will get less, and at that case what will happen, that angle is already close, the angle will get more blocked, and in that case IOP may raise very fastly, right? And it can damage the patient's eye. So you should not dilate patient, and in these cases gonioscopy is advised, right? This is all about the von Herrick technique, where we have discussed that the open angle. Gradings are not much important, but you should know that what is the difference between the open and closed angle. I'll add the pictures in the end as well, so that you may know that how it appears on the slit lamp, right? So in case of any query, you can comment in comment section, and don't forget to share it with your fellows so that they may also understand this technique. Thank you so much.